Hi, my name is Vanessa, walantus, and for the next video what we're going to be doing is we're going to be inspecting the head, the face, the neck, and the lymphatic system, okay? So first thing we're going to want to do is inspect the skull and make sure that there's no abnormalities. So this particular patient seems to have a normal cephalic head, which means that its size is proportionate to the rest of his body, so that looks good. The hair on the top of his head seems to look good. Hair on his chin seems to look good as well. There isn't any lesions or anything noted anywhere on his head. No abnormalities, no bumps, no bruises, anything like that. Okay, so next thing we're going to do is inspect the face as well as palpate the face. Okay, so can you smile for me? Can you make a sad face? So what we're assessing for is to make sure that the expression that we're requesting for the patient to show is in fact what's on his face, which all of that looks good as well. Also, can you close your eyes? Can you open them? Can you squint? Okay. So also what we're looking for there is to make sure that there's symmetry in the movement that assesses the functionality of cranial nerve 7. Okay. Also, we want to make sure that there's no orbital edema. No edema anywhere else on the face, no swelling. Next thing we want to do is palpate the temporal artery. Make sure that they're present and lateral. Also the temporal mandibular joint. Open your mouth. Close your mouth. Okay, we want to make sure that there's no limitations, no pain. Any pain? Okay, very good. So that's next. Next thing we're going to do is assess the neck and its range of motion. So tuck your chin to your chest, please. Right to left. Other side. Okay, how about all the way back? Very good. Okay, so any pain with range of motion? Okay. Next thing we're going to do is I'm going to have him shrug his shoulders to check the functionality of cranial nerve 11. So go ahead and shrug your shoulders for me. Okay, very good. Okay. Next thing we're going to do is auscultate, assess the lymphatic system, the salivary glands, and the thyroid. So there's no lumps. Any tenderness anywhere? Okay. Next thing we're going to do is check the thyroid. You can do this two ways. One of them is auscultating from the back. So you're going to start here. Really, you should not feel the thyroid unless it's enlarged. Okay, no abnormalities there. Okay. Also, we're going to check for tracheal deviation. So we're going to place our finger in the center of the trachea and move it to the side. It should not deviate too much. Okay. And if we did have any enlargement of the thyroid, we would also auscultate for a buoy, which in this case, everything is within normal